Cheers.
We're ready. You can tell this is the second one we filmed today.
Just giving away all of our secrets.
Loopy. I know. Shocker, people. I'm Dr. Kelsey. Thank you.
Welcome. Dr. Kelsey, you okay there?
Yeah.
Okay.
Just making sure the mic.
Yes. So you're a physical therapist, right?
I'm Dr. Kelsey. I'm a
trade.
physical therapist by trade, and I work with moms and babies in their homes, not a real baby, pretend baby. And I'm here with Dr. Rhee. Dr. Rhee, tell us your credentials and what do you do?
I'm a chiropractor. I exclusively see women and children. So Chiro Mamas, where women and children thrive.
Yep.
And then this is my mascot, our mascot, Maple, the Chiro canine, giving me the side eyes. Hi. So
she's like, don't point me out. Don't tell my friends I'm here, Mom.
Right, Mimi? Yeah, side eyes, getting the side eyes. So we had a great conversation last week, which was actually just like a few minutes ago.
4 minutes ago. And we're
oral ties.
Oral ties. All the different oral ties.
Yes. But let's move on to feeding in regards to like kids that are a little bit older. What do you think about that topic?
So it's funny because
I feel like you do way more of that than I do. So I think.
Yeah, probably.
Yeah, I don't really
I mean, and older is relative, so we'll put some parameters on that in a second. But it's funny because technically, if your baby has an oral tie, or if you have an oral tie, if you don't have it released and go through rehabilitation for it, it doesn't just go away just because you're older or just because we stop breastfeeding or bottle feeding. So when we think about, just for a caveat of, if we, let's say, don't have the support or it doesn't get released with rehabilitation and we don't get chiropractic care and we don't see the function improve, you could be like, well, at least we'll just get through bottle feeding, or we'll not breastfeed, or we'll just get through breastfeeding and then we'll be fine, right?
Right.
So not to be alarmist, but the tongue mechanics, the jaw mechanics, the cheek mechanics, the breathing mechanics, all get altered, and then chewing is still hard. Swallowing is still hard. Drool is still hard. Managing saliva. So just a reminder of like, that's kind of what we're talking about here, is that it still can affect how the feeding happens after bottle or breast, which technically we could introduce table foods around 6 months.
Yes.
And then go from there.
I see it, and I also try to warn some of my moms with that, where I say, well, these are the issues the first 6 months of life.
Right.
If this doesn't get somewhat addressed, the chances of picky eaters are higher. Kids that have sensory issues with their mouth, speech delays can also be an issue, right? And people forget too that your whole head is innervated by the trigeminal nerve, which is a cranial nerve, and that gives also function to your eyes, right? Your breathing mechanism, your olfactory mechanism, your ear, how your ears is draining. So your whole your sinus cavity and your whole head can be also altered. And we also know that without proper feeding mechanism that is being kind of settled and taught early on in life, it really also depends on how often the ear infections can happen. Sinus infections, tonsillitis is another big one. But the bigger one is, how are their airways being shaped during that primary years, and how that's going to alter their just overall well-being as they get a little bit older as well.
So when it comes to, like, we're thinking, they would probably breastfeed past. We talked a lot about in that when it comes to oral ties, the intervention point within the first 3 months or so, 3 to 4 months of life. Yeah. And then at this point, it's kind of like, okay, what are we introducing when they're feeling comfortable with doing a table food or a snack or whatever it is for the family. But like you said, being able to, well, what does that mean? Like, what does that really mean, Dr. Kelsey? It's like, well, being able to use the side of your mouth to actually accurately chew with your back molars versus tear with your front teeth versus move that food from side to side versus chew with your mouth closed, which is a lot of times a polite thing.
Yeah.
But it's
also
actually
a
a functional thing.
Yes.
And most of the time the kids aren't being like, I'm just going to be annoying and chew with my mouth open.
Right.
Like, that's not really what they're thinking.
Yeah.
They're literally thinking they can't breathe through their nose. So they have to chew and try to eat and breathe at the same time, which doesn't really work.
No. Well,
so they
also breastfeeding, right? So like, if
so they come off, and
then they go back in, right?
Yeah. So drinking, if you're noticing a kid who's like drinking, obviously if they're really, really thirsty, I guess that could happen.
Gulping it down, you mean?
Yeah. But the rarity of like, if that's always a consistent thing for them, they're not able to inhale through their nose while they're drinking the liquid. So it's just, signs and things that people always feel like are really, really, they're common, but they're not actually typical.
I think we can also translate that to like adulthood. Like, think of like grown adults where they're just chewing with their mouth open.
Or they like don't chew their food really and they
at
just
all.
like
They just
swallow hard.
Right. Right. People who are heavy snorers too. That's a big indication. Like there's definitely stuff going on in their mouth that was not well addressed, right?
Yeah.
Recessed jaw.
Yeah.
Like full grown adults where their jaws really recessed.
Yeah.
That tells me you probably didn't get a lot of tearing and
right.
Like when you were a kid as well, right?
So the things that we're thinking about, like if I, most of the time, a lot of the babies, luckily, not always, I have had a rare toddler with torticollis, but which is like very rare, which thank God, because it's really hard at that point. Like a 3-year-old who has torticollis. Anyways, most of them are early on being referred, but the reason
when they're a baby, you mean?
The reason why we're working on the trifecta, why I'm working on and you're working on the trifecta of the neck with the mouth with the head, is because soon, so soon, you're going to have a child who you want to transition to table foods or start to introduce it, and you're afraid about them choking.
Sure.
And it's like, well, then we need to be able to chew effectively so we're not choking. So we have to have both sides of the neck working. We have to have everything working in the mouth. We have to have, like you were saying, the regulation, the nervous system regulation, to not feel like we need to frantically be swallowing food that's whole. I mean, maybe speak to that a little bit too, as far as like the regulation of a meal. Encountering a meal.
I mean, I guess it depends on the stages of life, but I mean, if I see
like a toddler,
like a toddler, I think it really depends on like how they were set up in their first year. But like if I see a kid that just loves to put things in their hands and put it in their mouth, and they're putting, like if they're very tactile kids, they tend to do. I tend to see, and again, this is just in my practice and my observation over time, they tend to be really like very confident, and so their nervous system isn't as like lit up, right?
Okay.
Kids are kind of a little bit more, kind of shy about things. They're hiding against, but then you can see their personality in their table food as well. They're like, I don't know if I want this. I'm like, like, even if they're like toddlers, like 2 years old, and their personality is going to show. Those kids, they tend to be a little bit more lit up in their nervous system, for sure. Usually more, their parasympathetics is just not on, right? So they're always kind of a little bit more on the fight or flight, like just something is going to happen. I don't know if is this good or is this not. Do I like it? Do I not like it? Right? So their sympathetic side of that nervous system is always kind of like not regulated well. So I find that they end up having more digestive problems, like bloating and constipation is more common with those kids. But kids, and it's interesting, we say it's personality too, but I think it's just because they feel better in their body, right?
So
they're just more confidently eating and doing well with the food that they've been introduced to.
Right? And to your point of like the setup of what's happening at a mealtime, which I'm not an OT, but a lot of that has like been carried over from my OT friends and just continuing education, where it's like there are things that we can do to support them internally, like you were talking about the nervous system regulation of what is your baseline, but then also that's an adjustment, or that's a short window of time.
Yep.
They have all of these other hours in the week,
Yeah.
and all these other opportunities in the week that we want to set them up for
success. Yeah.
Less distraction at mealtime. And I do agree, it's hard. I do not claim that my kids, when they were little, that we really had to, like I said, we didn't have the TV on, or we had it muted, and we didn't look at what we were sitting away from that. And it drove my husband crazy because it was never like that in his house when he was little. I don't care, it's our house now. So we really attempted, sometimes we will have a fun night where we have friends over and it's not a big deal. But they have also built so much of that over years, literal years of their life for the adaptability to then be like, okay, so we're going to eat something.
Conditioning of that.
Yeah, like the conditioning of this is the chair. This is a chair that we sit in. So we don't feel like we're like all over the place. Yeah. Sit all the way on the chair.
Right.
Don't be like half your leg off. Which people are like, do you really get that? And I'm like, I do.
think that's important.
I'm like, slow down.
Yeah.
We're not going anywhere.
Yeah.
It's okay. Everything's fine.
I don't know how much nutrition you talk about with your moms about it, but I talk about nutrition quite a bit with my patients.
Yeah, I don't a ton. I usually refer them.
Okay.
If it's
so
like,
nutrition, I think is another big problem, right? So kids that are eating highly processed food or to-go foods or you know pick up like takeouts and stuff like that. If those are the family life. That's what they're going to be gravitating to, even if they haven't been introduced to it yet, like at toddler years, right?
Yeah.
That's what they're seeing, and that's what they're going to smell, right? They're going to see it, smell, eventually touch it, and that's going to be like more introduced, and that can really cause some issues in their mouth as well, right?
Yeah, because it's usually softer.
It's
usually chewier, or not even chewier. It's usually softer and more like disintegrates in your mouth versus a hard,
and where you can chew on it, but also if they're highly processed, there's more sugar and salt in it, more chemicals in it, which causes that brain to not function the way it's
crave that
and crave that and causes the mouth to salivate more when they're in that introduced or in front of those types of food as well, which it feeds the problem at that point too, right? So, I mean, I have like grown adult friends who are like, no, I just have to have French fries on almost every meal. And I'm like,
every meal?
Almost every meal?
I mean, I love a French fry.
I do too. But almost every meal, every day you have to have French fries. Like, so that tells me, and then I see those friends who are like, oh, that's why you mouth breathe all the time. And that's why you're not breathing through your nose, you know? So, yeah. So
it's tricky. It's a challenging to try to, but that's also part of what we were talking about in that previous episode of, can we understand, I know there's a lot going on in that fourth trimester, but if we apply it to both yourself and your baby, it might actually be a little easier.
Huge.
Because you're making adjustments or you're taking little steps. Little steps, very simple steps.
It's a one degree
Give yourself
change.
A win. Give yourself a tiny win so that you have the understanding as they're growing. And then like we were saying, you can have the advantage of utilizing functional therapy or therapy that's going to support as they're going. Like we're going to do the best we can.
Right.
Let's just do the best we can with that information.
Right.
But I think that, like you had said, it's really multifactorial. So many factors that it's going to be easier if we're thinking about that prenatally, or just even having a neutral awareness of like, what would I do in that situation? Like there were so many things I didn't ask myself during pregnancy about what parenting decision or what childhood development decision would be, or like how we would do that. And that's that's a lot of ego, because I wasn't taking into account that like my decisions wouldn't just be the only ones made. Like my input wouldn't be the only input that there is. So that's my fault. But you can ask yourself that in pregnancy and try to think about like, what does feeding even mean?
But I mean, think about how hard that is for someone who is not even educated in this too. So like for you, even with that, it's like, you know, you're in that space.
But if there's people that are asking
more, you think?
More of their provider.
Yeah. Oh, yeah, for sure.
So hopefully it's like,
Yes.
well, if they're asking more of their providers,
For sure.
and it's more in the ethos of like what's around social media and communities that they're hearing, then maybe there's more hope to be able to be like, to ask
there's
questions.
A huge difference in the way like thinking back, the way even 10 years ago, maybe even like 15 years ago when I was just starting out, I was starting maybe a few years into my practice. I'm just thinking back to like some of my moms back then, right?
Yeah, how what they're asking you
they're asking. They're not really asking a whole lot. You know, they're just like oh, like you tell me what's going on, right? Whereas I feel like nowadays there's definitely more moms now asking questions, and I think there is a huge factor in regards to the information being more readily available through the phone and the Google and the ChatGPT now, and
just what someone might tell you who's pregnant, like a friend of yours might be like, oh, I am really interested in this, and maybe you're not interested in it right that second, but maybe a month later, maybe after your pregnancy, maybe after you give birth, you're like, it comes back to you like, oh, maybe I should think about that aspect of it, or maybe that's a decision that I don't. Sometimes even not wanting to ask that question is helpful enough in that time. Like someone being like, I don't want to worry about processed food, I don't want to think about it. Even that negative association with it is enough for you to go through the process of thinking about it for at least a second, and then maybe something happens and you do want it. You do change your tune, and you're like, oh, I didn't care, and now I really do have some curious questions about this.
Well, I think we have to also think about the moms in regards to, again, I'm just going back to 15 years ago. I don't think moms were as talking to each other as much about it. I think they kept it more in their own smaller circles to talk about. I feel
like family.
Yeah, maybe family. I feel like nowadays women are a little bit more bold and more kind of like empowered to ask for more things. So I think that's another thing, which becomes a great advocate for their children as well. Whereas back then, and again, I mean, maybe even 25 years ago, which, I was not even in practice, but I'm just thinking like even 25 years ago, 30 years ago, you just take the advice that you are given. You're not really seeking for, unless there's something seriously wrong with your child. These are things that a lot of times, even now, I think it gets missed because feeding issues it's such an individual thing that happens, and every child is so different that I think nowadays I definitely see it, moms like asking for more help, which is great. I think we're in the right direction with that. I think, but back then, I think that the reason why our generation, maybe my generation too, I think a lot of those things were missed because it was just not brought up a lot of times.
There was a lot of like, well, you turned out fine.
Yes, exactly.
And so why?
You're fine.
Like, you turned out fine,
you're
or
speaking.
We didn't have, you're standing,
you're eating
vertically. I wouldn't say straight, but
not even now.
I do think there's a lot of evolution with an option to ask a question. Now I think we're in the phase of, well, if we ask this question
or ask for help,
is it within my means to access this help?
Oh, yeah.
So I think before it was like not even an option. Like you said, you're fine. We did that with you, and you turned out okay. And I'm like, can I tell you how much therapy I've had? I think there's something that like could have been avoided. Okay, a little bit. So I don't necessarily know if that's true, but now we're in a phase where it's like, I see that this is the recommendation that you have for me. How do I actually do that? How do I actually
approach it, address it,
and if I
treat
pay
it
for this, how do I actually know I'm going to get the result that you're talking about? Which then the next phase being like, okay, I'm going to invest in this. Now I have to complete the activities, like I as the consumer. I mean, how many continuing education classes or things that I have taken, and I'm like, that's really cool, great, I'm so excited to integrate it. And then I'm like half integrating it, or I don't watch the rest of the webinar. Webinars mostly. In-person stuff is easier, but webinars for sure. that we're not actually doing the things that we
applying
said
it.
that we're going to do.
Yeah.
Which is the human experience
right
in itself.
So
but
implementing it.
Hopefully we're like shifting as a community to being like, okay, I hear what you're saying. We're going to do this. I will do those things that we talked about. And it's hard. It's not easy.
Nor cheap at times.
Yeah. I mean, cheap is relative.
Very true.
Right?
Very true.
But like, what is it that's limiting me from
commitment
taking this? I mean, we just talked about earlier before we even started recording. I'm going to bed earlier.
Yeah. Commitment.
Not every night, but like 80, I'm sitting at an 85% of time.
That's a B.
So I want to stay there, but that is not, it's not hard. Kelsey, just go to bed.
Just go to bed.
But it's like, okay, then I gotta not look at my phone or turn off the TV or not read the thing or not talk to my spouse.
And we're talking about this in a way that you're implementing that level of commitment to make the changes that the child needs to make that therapy work for any feeding issues or oral issues that may
to
have.
Get the result that you
just dots there for people.
You're saying okay,
it takes time, it takes effort, it takes energy and discipline and the level of commitment to go through it. And the earlier you do this in their age, the faster, the quicker results you will get. The longer or the older the child is, harder for those things to change. Just like adults, right? I mean, you're not going to try to get an 85-year-old to change their ways. It's just not going to happen.
Yeah, and I will say, even with our comparison of our two kids, is that the ship has sailed for a release at this point for my older child.
Oh, yeah.
He's 7. He's going to be 7 in January. I have not willingly put my finger in his mouth for 4 years. Okay. I think maybe helping brush teeth every once in a while, but that's like, so, having the information to say, okay, I understand that this is the path we're choosing right now. I'm okay with that. I'm confident with the most effect that we can make in this time frame, and then revisit it when he's ready. And he has more cognitive understanding of sports players, professional athletes get surgeries all the time. What do they do to recover from that? Versus like a 3-year-old doesn't get that.
No. Right.
And the second child, I did it when he was 2 months because I was like, we either are going to do this or we're not going to do this.
Was it a tongue release for him?
It was tongue, and it was tongue and lip. It was not
tongue
and upper lip.
Okay. And Braxton is tongue too?
He would probably be tongue. I think his lip is not necessary. I think his tongue would need the release.
I see.
I don't think he needs buckle ties. But that was like, I would have to have him assessed again probably. Because I'll probably I'd have to have him assessed again.
Yeah, again. Right. I mean, cute kid though.
I know, he's really cute. We still may end up having braces. We'll see what happens. I don't know. But maybe we can do other expander options earlier, which would be right around this time. Right. So you just have to have some kind of intention. I give kudos to parents who at least know this is the decision you're making versus feeling like, well, I don't know what we're doing about feeding. I'm just going to gray area.
But I think I want to wrap it up with, I think what is the alternative to some of the moms said, I don't want to release it. Like, what are my other options? Right. And so to me, sometimes I do have to tell them, like, you're going to have limitations.
1,000%.
Limitations.
Exactly.
What you just
said. I'm like, it's okay.
Right.
But no.
But the other option would be, let's first figure out, if the spine alignment is going to release some of that tightness. Because I always say, it's still a soft tissue. There's a reason why it's soft for a reason. It's pliable and malleable. You can shift it just like our muscles. When it gets tight, you can release it in that way. So it doesn't have to be a surgical release. Let's see if we can manually release it by changing the balance and the symmetry of the body as well, right, as a chiropractor. So I think that's one thing. And then the other way would be, obviously, on top of that, I think the best way would be getting that internal release in our system, especially in our nervous system and our skeletal system, so that all your soft tissue that's anchored onto it can move and change and, do what it needs to be doing. And then on top of that, layer it with some really amazing physical therapy exercises and
for the longevity.
For the longevity, right? And then I've had moms like right now, like, let's just keep your hand in their mouth as much as possible. Like,
1,000%.
all the time, before feeding, after feeding, if you can't, like, ideally before feeding.
I know.
Right?
Yeah.
But it's hard to do. But again, that's another conversation about, right? Like commitment and being disciplined and being able to do that, and I try to do a lot of that when they're here. That's the reason why my infant visits are a lot longer.
Sure.
Than my,
because so much of it too can be supportive of what the parent is doing. So it's like you still need that time.
So how much do you spend? How long are your like typical infant visit last for?
So they're an hour.
About an hour. So you do a lot of that work.
Yeah, and I always say if they fall asleep,
great,
it's totally fine.
Yeah,
not a problem. They're like, but I'm like, it's not the same as always what your session would be like as an adult. If you fall asleep, we can't communicate about what's happening here. And there's a certain amount.
Got a dead body trying to.
There's a certain amount of like feedback or awareness because you're aware as an adult to make those changes, which is a baby. I'm educating you on what's happening here, and they're responding to that.
Yeah, it's more passive. I'm going to assume.
It's more passive.
So for
at least in that frame. Yeah.
Well, great conversation. Great.
Yeah, that was good.
Anything else that you want to add?
I don't think so. Okay. I think we did, and I think it was good to give like just the oral ties themselves.
Right.
And so if you missed that part, if you didn't see that other episode,
go back to it, please.
Just what it is anatomically, what we're talking about, where it lives, how you're looking for that. And then also here being like, it's really dependent on what age and some of those other factors that we are making a decision about that. So,
well, thanks for the conversation.
Thank you.
We will be back for another episode. I think we got a couple more scheduled up.
We do.
And should be soon.
That we're airing.
Yeah.
And if you're seeing this, like, I don't know, 2 years from now or whatever, then just know that we haven't gotten an outro down yet. You got to start somewhere, people.
Exactly. All right. Well, cheers to that.
Cheers.
All right. We'll see you on the next one.